Well, Schwartz's Bait and Tackle in Hamilton County has something few Indiana businesses have, but many are finding they need: an opioid overdose box to help workers and customers who overdose. The pandemic has caused a dramatic spike in the number of overdose cases in Indiana and around the country. This new program in Hamilton County is arming businesses with the tool to fight back. Business of Health reporter KYLIE VELETA joins us now and tells us already one life has been saved. KYLIE.
That's right, Gary. Hamilton County says it's the first community in the state to give local businesses free opioid overdose boxes loaded with NARCAN, the medication that can reverse an overdose. One business already used the box to save the life of an employee. Monica Greer is executive director of the Hamilton County Council on Alcohol and Other Drugs, and she joins me now to tell us more about the program. Thank you for being on the show today, Monica.
Thank you, Kylie.
Tell us first what exactly is inside the box, and explain really how simple it is to use in an emergency.
Sure. Inside the box is 2 doses of nasal spray NARCAN and also a set of gloves. So the nasal spray is used very easily, and it's there for the staff. And we have the staff trained with NARCAN by our local health department, the Hamilton County Health Department.
Okay. And so these boxes are kept in back. They're not out in the open, right?
Correct. We ask the businesses to store them in an office area or an unlocked area where all staff are aware that it is, but the local patrons cannot get to it.
Okay. So these boxes really are designed for time, because to save time, because time is so critical during an overdose. Can you explain that?
Yeah, it's literally life or death. Within 2 or 3 minutes, the person could not survive the overdose. So we are asking local businesses and agencies that need the box or feel like they want to have the box to help save a life, put in the businesses. And the boxes themselves, like I said before, very simple. If an overdose does occur, the staff are to call 911 and then check for breathing. If the person did not overdose on an opioid or just had another health condition, the NARCAN is not going to harm them. So we ask them to check for breathing. If it's shallow or non-existent, then we have them do 1 dose of nasal spray and check for breathing after 2 or 3 minutes. If they're still not breathing on their own, then they'll do a second dose if the emergency responders have not arrived yet.
Okay, so with this grant, you've been able to give the boxes to 10 businesses in Hamilton County for free. Explain what businesses you're targeting and why.
Sure. We work with the local police and fire departments in our county, and we've asked them for advice on agencies or businesses that they're aware of, that they've done runs on overdoses. So we started there. We started with the education piece from them. So we targeted some businesses that had had overdoses occur in the past, and those were either restaurants or local convenience stores, hotels. So that's where we started. But we also did a media campaign to where we educated everyone in the community on the boxes in case they want to have one at their businesses as well.
And you say when people hear about this, they sometimes think of patrons, but these really aren't designed for the patrons, for the customers, right?
Right. It can be, if someone uses in the bathroom or something, but generally it's been staff or someone that's living in the hotel or staying at a hotel. So just what we've seen in the past has been more of staff or, like I said, someone living in a hotel room or, close by. So for instance, a business may have a box of NARCAN, and we've educated the community on who has the boxes. Then other local agencies that don't have them may be able to get something from a local business. But hopefully our first responders will respond in a time frame that just 1 dose or 2 doses will be all that's needed.
And you mentioned this box has already been used. One of the 10 boxes has already been used in an overdose situation, likely saving that person's life. What has response been like from businesses? Are they open to having these boxes on hand?
Yes, especially the business that the NARCAN helped save the life of the woman that overdosed. But yes, very good response. The staff, they don't want to see it happen, but if they've experienced it or they know that it could happen, it just really reassures them that they may be able to help the person prior to first responders arriving at the scene.
Just a few seconds left, but other communities, other areas in the state who might see this story, would you encourage other communities to consider this, and what advice would you give them?
Yes, definitely. It's a very inexpensive, easy project to administer. And like I said, we've gotten really positive feedback here, so I would encourage it. The boxes themselves, including the NARCAN, is about $100. So that's fairly inexpensive. Even if the communities don't have grant dollars, the agencies or businesses themselves may be willing to pay for the box just to have that resource in their business.
Okay, Monica, it sounds like a good program. Thanks for being on the show and telling us about it.
Thank you so much.
And Gary, back to you.
All right, Kylie, thank